Hi, Dr. Sasse here from Sasse Surgical. So a question I was posed is, when is the right time to think about and pursue metabolic surgery? And really this is a question that deserves a little bit more thought than initially it might appear when it's first being asked. Because of course there are criteria that are published and that the insurance plans follow and the medical society guidelines follow that have to do with body mass index at certain thresholds. And so a simple answer is simply, well, once your weight hits that certain threshold, then you should consider metabolic surgery. I would say that there's a little bit more of a consideration, and that is that in fact most people have hit those body mass index milestones a lot earlier. And many times people have a BMI over 35, which really starts to make them eligible for metabolic surgery. But they're living with it for years and years. And other times people have hit the threshold of a BMI of 40, which makes almost everyone eligible for metabolic surgery. And again, they've been going to work, taking care of their family members, and living life with that body mass index for years and years before it dawns on them, or before a friend or a loved one or a provider tells them that metabolic surgery might be something to consider. So it's worth mentioning our perspective as people who see the whole spectrum of obesity as a disease and the toll that it takes over the years and over the decades. And that data is very clear, giving a very resounding answer to the question of when is the right time to think about metabolic surgery. And the answer is that the right time to think about it is early. The right time is probably right now. If you or a loved one is suffering with obesity, excess body weight, BMI over any of those thresholds, let's even say a BMI over 30, then what's happening is day to day, month to month, year to year, that excess weight and all of the surrounding physiologic responses that are happening with it are taking a toll on the body every day, every month, every year. Most of that toll is silent, meaning that it doesn't necessarily cause pain or lead you to run to the doctor, but it is very quietly, silently taking a toll on the kidney function, for example. It's very silently causing a pro-inflammatory response. That means our body's biochemistry is in an abnormal pro-inflammatory state, which itself is associated with bad things like blood clots, like cancer formation, probably like dementia, probably other chronic diseases. And so quietly in the background, obesity is taking a toll, which we know leads to diminished eventual quality of life and diminished length of life. So waiting for more years to go by while that silent toll is being taken from the obesity is not going to be helpful in the long run. So earlier is better. So if let's say your spouse body mass index climbed up over 35 and their doctor is saying, you need to lose some weight, but otherwise your health is pretty good, maybe some mild cholesterol or kind of what seem like mild things. It's not too early to start thinking about it and come see a professional, someone like me or people at centers like ours around the country and around the world who can give some good advice. And that advice might be, listen, today you may be in a gray area in terms of insurance eligibility or not being quite ready perhaps for metabolic surgery, but it's good to get informed and perhaps with some renewed diligence toward daily exercise and improved diet and all of the sort of counseling and advice that a center like ours can offer from a multidisciplinary perspective. It may be that you can stabilize that BMI or even get it to trend downward with some changes in the life you're living, the hours you're working. It also can be a time to really take in the information about what is the path toward metabolic surgery and what does this look like, and is insurance going to cover it, or what is it going to cost, and really get a sense so that if that day arrives where now your doctor is mentioning, hey, you need to start on a blood pressure medicine, or geez, that hemoglobin A1C has drifted up into the pre-diabetes range, or even worse, into the full-blown diabetes range, then really that is beyond the time where it's needed to go and move forward with metabolic surgery. What you'll learn as you investigate it, investigating it early leads to the understanding that metabolic surgery has come a long way. We're now dealing with one of the safest, most regularized procedures done anywhere, safer than an appendectomy and safer than a gallbladder, hysterectomy, or many widely performed common procedures. With a very targeted 45-minute procedure that is typically the sleeve gastrectomy procedure, it will change the hormonal physiology and the biochemistry by targeting the stomach tissue that is an epicenter for where those hormones come from. And that change in biochemistry is just not something that we can achieve with medicines or with any other intervention, but it's powerful. And that powerful change in biochemistry changes our metabolism, changes our metabolic rate, it lowers our triglycerides, it lowers our hemoglobin A1C, and it lowers body weight with time, with weeks and months, and usually not many months. And that change is so profound that it immediately confers an improvement in the risks that we are facing day to day. It reduces that pro-inflammatory environment of our metabolism, reduces our risks of things like stroke and things like blood clots and things like diabetes and many of the other adverse health events. And by reducing those risks, it adds years to our life. So when's the right time? Well, the right time is now. If you're thinking about it at all, or you're thinking about it for your loved one, it's time to go get additional information. And certainly if your body mass index or your loved one's body mass index is over 30 or 35, there's a good chance that it may even be covered by insurance at this point. Certainly if the body mass index is over 40, then it's almost certainly going to be covered by insurance as a very clear medically necessary health intervention. And what I think you'll find if you go investigate it now instead of waiting is that you'll realize that the risks of proceeding with metabolic surgery are far lower than you may have imagined, and the risks of continuing onward to live with those excess pounds and the toll it takes, those risks are far higher than you probably imagined. And so the choice becomes clearer that dealing with this problem earlier is going to be the safer alternative with the most profound, long-lasting improvements in quality of life and health. So I hope that framework has been a little bit helpful in kind of helping you interact with a loved one or thinking about it for yourself. As always, any questions, feel free to reach out to me or our practice at Sasse Surgical, or find an outstanding accredited center in your area where you can get similar information as well. I wish you the very best of health.